Hello and welcome to my skills presentation. I'm going to be demonstrating different types of splinting. It's going to tie into my larger lesson about orthopedic injuries. We'll go more into depth when that comes along. Right now we're going to be focusing on the specific skill of immobilizing injuries to the extremities. So we're going to demonstrate care for musculoskeletal injuries in this skills demonstration. We're going to demonstrate a rigid splint, traction splint, and a sling and swath. The materials I used were some padded boards, padded long boards, triangle bandages, a traction splint, and I used gauze wrap in my video, but for that material you can substitute ace bandage or co-band, whatever you have available. Some general rules of splinting that I want to keep in mind. Remove clothing wherever you're suspecting the fracture or dislocation. To inspect the area, you can remove clothing with the trauma shears, or depending on how loose the clothing is, maybe roll it up. You might not have to cut it, but if you have to cut it, it is what it is. You want to be inspecting the area for obvious deformities is obviously going to be the biggest one. But any open wounds, penetrating injuries, contusions, crepitus, things like that. So we always want to check PMS before and after splinting. We want to make sure they have a pulse, make sure they have motor sensation and sensory sensation. Can they feel you touching them? Can they wiggle their fingers? Before and after splinting. And then you want to continuously monitor during transport as well to make sure that the extremity has not become pulseless. If the patient has an initial pulseless extremity due to a fracture or a dislocation, you do have one chance to manipulate the injury and try to regain pulse back. However, if you were unsuccessful in your first attempt, you don't want to grossly manipulate the injury. You just kind of want to splint it in place and get them to the hospital as fast as you can. Before you splint anything, you want to cover any open wounds with dry, sterile dressings. You want to make sure that bleeding is controlled and that wounds are covered prior to splinting. That's going to be priority number one. If there's any resistance in positioning a deformed limb, you can splint the limb in the deformed position. You want to, like I said prior, not grossly manipulate the injury, causing possibly more damage and unnecessary pain to the patient. Splinting is a form of pain management, considering basic EMTs don't have the same such a broad scope when it comes to pain management. So splinting is going to be one of the things that we can do to minimize pain for patients by keeping those injuries stable. Considering we can only really give Tylenol and NSAIDs, and we don't want to give NSAIDs in a case like this because if the patient needs surgery, then NSAIDs are contraindicated. As always, scene safe, PPE before walking into a scene in real life or any skills demonstration simulation. You want to make sure that's always the first thing we're thinking about. Now we're going to move on to the demonstrations. Give my actors some grace. Neither of them are in EMS, but I think they did pretty okay for never doing this before. So we are doing the first skill we're going to do is rigid splints. We're going to be looking at how to do a padded board splint. Indications for this kind of splint could be a suspected long bone fracture. I'm doing it on someone's lower arm, so a suspected, forearm fracture, radius ulna, or a dislocation of the wrist, or a fracture of the wrist, because the wrist can be a tricky joint to wrap. But this splint that I demonstrated in the video would work perfectly for it. The specific video, I used 2 padded boards and 2 triangle bandages. First, we're going to go over long board splints. You want to make sure you stabilize the injury manually. You have your partner come over and hold a padded board underneath. You want to check PMS, make sure the patient has a pulse. Can you feel me touching you? Can you wiggle your fingers? Alright, I'm going to have you hold on to that. I'm going to bring it down just a little bit. And you're going to start at the distal end of the injury. You're going to go ahead and wrap around. You don't want to wrap over the joint. You want to make sure it's stabilized underneath the joints. You can also do this with an ace bandage, triangle bandages, co-band, whatever you have available. After you're done splinting the injury, you want to go ahead and check PMS again. Can you feel me touching you? Can you wiggle your fingers? Perfect. Alright. For the next part of our skills demonstration, we're going to be going over how to splint hinge joint injuries with rigid splints. Indications would be a suspected joint fracture or dislocation. Primarily, you're going to probably be using these splints on elbows and knee injuries. In the video, we're doing an elbow injury being splinted. We used 2 padded boards and 3 triangle bandages for this. PPE, you're going to assess PMS. Does my patient have a pulse? Can you feel me touching you? Can you wiggle your fingers? You're going to have your partner come over, manually stabilize the injury. You're going to tie a triangle bandage around the joint, obviously being mindful of the injury. You're going to tie it very loose. Then you're going to have your patient or your partner grab long boards, put the padded side, make sure it's touching both long bones, but it's not on top of the joint. You're going to do a figure 8 tie on each side of the long boards. We're going to tie them loosely at first. Do the same thing on the other side. Once you have both those tight, make sure they're up nice on the long boards. Try to make sure they're tight. Do a little bunny ear. And you're gonna untie this loose knot you put. You're gonna come up on top to find a little immobilization. Tie a nice tight knot. And you're always going to reassess PMS. Does my patient have a pulse? Can you feel me touching you? Wiggle your fingers. Perfect. For this next skill, we're going to be doing the sling and swath. Indications for this immobilization technique would be any injuries to the clavicle, scapula, shoulder, humerus, elbow, any radius or ulna fractures, dislocations. The patient will most likely be guarding this injury close to their body, probably having their elbow bent up and close to their body, and the sling and swath helps keep them in that position of comfort and take some pressure off of the injury by assisting them holding it up. It's a very simple technique with 2 triangle bandages. We'll take a look at that. PPE always. You want to check PMS. Make sure the patient has a pulse. Can you feel me touching you? Can you wiggle your fingers? Alright. You're going to have a knot tied in this part of the triangle bandage. Okay, create a little pouch. Gonna cup the injury. That. And then you're going to use this one as support. You go around their body. Make sure it's nice and secure. Check PMS again. Pulse. Can you feel me touching you? You wiggle your fingers. Perfect. For our final video, we are going to be doing the traction splint. Demonstrates the use of an inline traction splint. This immobilization technique is used to splint a closed femur fracture. Any obvious deformity, pain, or swelling to the mid-thigh without an open wound, we would assume closed femur fracture. Contraindications are any injuries of the knee, any suspected pelvic fractures, any amputations, avulsions where there's bone showing, tib-fib fractures, ankle fractures, things like that. Really, if it's an isolated closed femur fracture injury, we are going to be using this traction splint for it. I would like to add that holding manual traction is a very important part of the skill. The partner's job is extremely important. You want to make sure that you're holding a consistent amount of traction the entire time before the ankle hitch is secured and you have the splint holding traction. The person in this video unfortunately wasn't holding manual traction as well as I would have liked them to during the skills presentation. So please keep that in mind. Always do scene safe PPE before we do anything. You want to... The patient has an obvious deformity on his right leg, so we are going to measure against his good leg, his left leg. We want to make sure that the splint is about 6 inches past his foot. We're going to have our partner hold manual traction on the leg that is injured, preparing the patient for the traction splint. We're going to assess PMS, make sure the patient has a pulse. Can you feel me touching you? Can you wiggle your toes? Perfect. Now we're going to step over our patient, or he's going to walk around. Or pass equipment over your patient. So while your partner's holding manual traction, you can hold it a little better. Just right there. Yep, just like that. And we're going to place it right under their butt, as comfortable as it could be. And then we're going to secure the ischial strap first. I'm going to make sure it's hugging the hip line. I'm going to grab the ankle strap. While your partner is still holding manual traction, you're going to attach the ankle strap. Make sure that's secure. Then you're going to attach the hitch and then pull, traction, preferably until the patient feels relief. Then then we're going to go ahead and do the rest of the straps. You're going to secure these not on a joint and not along the site of the injury either. And then you're going to reassess PMS. Patient syllable pulse. Can you feel me touching you? Can you wiggle your toes? Perfect. I wanted to thank you guys for coming to watch my skills presentation. If I had presented this to a classroom of students, I would have them pair off in groups of 2 to 3 after the skills presentation so that they could practice the skills on their own and receive instruction in person from other instructors in class, whether that be me or maybe there's another teacher, whatnot. And once they felt comfortable enough, I would have them be evaluated by said instructors or myself, and they could receive a grade on the skill, but only once they felt comfortable enough. Thanks for listening once again. I've never done anything like this before, and I'm on night shift, and I'm currently still getting used to that, so I'm just a very tired person. Sorry if I sounded less than enthusiastic during any of the demonstrations or even my slides. I'm still enjoying exploring teaching, and I'm very excited to be gaining more skills in especially teaching something online. It's very interesting, but I appreciate the opportunity.